Well, I think, first of all, it's important that people know that the staff who work here don't recognise the hospital that they see described in the media. They see this hospital as a place that provides good, safe, effective care for patients, that respects patients' dignity and privacy. I think it's important to stress that for elective conditions, elective surgery, patients are given a choice of where they wish to be treated. And what we are seeing here at Tameside Hospital is that the numbers of patients choosing to be treated here at Tameside is increasing steadily. The hospital's standardised mortality ratio is high, but it's important to stress that the care and the treatment that we provide here, we believe, is both safe and effective. The ratio is influenced by a number of things, and we've been trying to tackle all factors to reduce it over time. So, for example, we've increased the number of clinical staff that we employ in the Trust. We've had something like a 55% increase in the number of consultants over the last 4 years. We've actually made major improvements to the way in which we deliver services to people who've suffered with a stroke or people with coronary heart disease. The ratio actually looks at how many deaths are expected and how many deaths actually occur. And what we found was that we were understating the number of expected deaths by under-recording the range of conditions that patients were presenting with at the hospital. We were treating the patients for all the conditions that they presented with, but we weren't necessarily recording them and submitting them as part of the administration arrangements for the hospital's mortality ratio. The hospital's both safe and effective, but we can't afford to be complacent about our mortality ratio, and that's why we continue with all the efforts that we've made in the past to drive it down going forward. We've worked very hard to try to reassure the public and patients that they should be confident about coming to this hospital for safe and effective treatment. I think that the future is very rosy for this hospital. We've got a brand new hospital investment, £120 million worth of new hospital that's due to open later on this year. We were very successful some years back in attracting in major investment to Tameside in recognition of the fact that we provide good care, and it's something that means that we are very much on the brink of a new era in terms of the delivery of care going forward.